In late August, the COVID-19 Pfizer vaccine was fully approved by the FDA after previously being under emergency use authorization. There has yet to be a vaccine approved for children ages 5 to 11, but there has been a lot of talk about it. Our Nixon Norman tells us more about this approval timeline.
More than 500 children have died during the course of this pandemic from COVID disease. Right now, for 5 through 11-year-olds, COVID is the 8th leading cause of death in children. 8th leading cause of death. And so this is something that while parents, may say, look, I think it's unlikely this is going to happen to my child. They're right. It is unlikely, but it's not impossible.
Ever since the pandemic started, talk of a vaccine had been floating around. Fast forward to today. We have had these vaccines available to us for nearly a year now. Well, everyone except one group of people, children. But health officials are in the midst of more than likely approving the Pfizer COVID-19 vaccine for children aged 5 to 11.
An expert panel that was convened to look at the data from the Pfizer vaccine for 5 through 11-year-olds. They voted that the benefits of the COVID vaccine for 5 through 11-year-olds outweighed the risks.
But just because this panel gives the vaccine a thumbs up doesn't mean it's approved just yet, but there is a great chance that it will be, and soon.
With that, it will be taken under advisement at the Food and Drug Administration. They almost always followed the recommendations of their advisory panel, so I would anticipate that over the next few days, we will have a full authorization from the FDA for use of the vaccine in 5 through 11-year-olds.
The CDC is also doing the research on whether they want to recommend the vaccine for children or not. According to Kimberlin, those discussions should take place sometime early next week. He thinks the CDC will also follow suit.
So FDA says it may be used. CDC says how it should be used. And so I think by the time we get to the middle part of next week, we quite likely will be able to say that, yes, 5 through 11-year-olds should receive the COVID vaccine. We still got some more expert and independent reviews to undertake, but that's the direction this seems to be heading.
Nixon Norman, Fox 54 News.